So in this section, we're going to talk about strategies to effectively communicate about risks. And I think that this little mantra here by Dr. Ed Maybach, who's a climate change researcher and public health communications scholar, is a really compact way to think about what it is that makes good and effective risk communication. And he often talks about this in the context of climate change communication, but it applies for other risks as well. To effectively share what we know, we need simple, clear messages repeated often by a variety of trusted sources. So here, there's a couple of things that we've touched on previously: simple messages, clear messages, so that there's no guesswork about what types of risk people are facing and what they can do to protect themselves. These things need to be repeated often so that people can be reminded of how to protect themselves or be reminded of where to find appropriate information to do so. And also because sometimes we just need those additional cues or reminders to remind us to do the behavior. For example, a little pop-up text messages might be something that, for instance, a local public health or a city public health department does to remind people to wear their masks during the COVID pandemic. And then this last component of this message here is really key: by a variety of trusted sources. No one person or one entity is going to be trusted by everyone. And that's something that's really important to consider and know when we're thinking about risk communication. If you only ever have the mayor or the president talking about a particular risk, those entities are inherently political, and there will be some people who trust those people less. And there are many examples of this. So you really want to have a variety of trusted sources within communities so that people have people they trust to rely on for information, and so that there's an ecosystem of risk communication that's happening, and it's not just by one person, but it's happening by a group of people who have different audiences, and so that trust can be built across a number of people. And so I find this to be something that I think about often, and it's a relatively short thing, so committing it to memory wouldn't be terrible, and it helps you think about the different components that are important to think about with risk communication. So some of the key principles to think about when we're thinking about strategic messaging, and that's something else that I would like to just briefly say, is that risk communication is strategic communication. This isn't something that we want to do off the cuff. It's not something that we want to do without knowing about the risk, without knowing about our audience. And hopefully that's clear by now at this point in this training. There are very specific things that you should be considering, but these are strategic things that are important to consider so that we can make sure that we're having a communication that's impactful and effective. So some of these key principles are to be confident in your understanding of the topic. As Dr. Floyd mentioned in a previous slide, don't overpromise or don't say that you know things that you don't. And make sure that you do your research ahead of time when you're talking about a particular risk so that we don't damage that trust that's so important that we've been talking about. Be concise and use plain and simple language. You want to be able to talk to people at all levels. And so if you're using really complex technical language that you would find in a scientific document, not everyone is going to be able to understand that level of language or what some of those esoteric languages are. So really using plain and simple language that's accessible to everyone in your audience, and that language may be different. If you have an audience that primarily speaks another language, like Spanish, perhaps that's also something to consider. So using plain and simple language to make your message accessible is really important. Again, be strategic. Apologies that we keep popping back here. Being strategic is really important, and building in these components to create a communication that considers all of these elements will help make it more likely that your message is impactful and effective. You want to be convincing, and part of being convincing is being confident and making sure that what you're talking about is evidence-based. And this meaningful piece is really making sure that your message is meaningful to your particular audience. So if you are trying to communicate about hazards in a particular type of workplace, for instance, it's not going to make sense for that to necessarily be a community-wide communication campaign. It might just make more sense for it to be for those people who do that type of work. For those people who are not doing that type of work, it may not be a meaningful message. Making a message that's memorable is also really helpful. This is a really silly example, but it's something that is memorable that I've remembered ever since I saw it. So in the DC Metro system, there's these little cartoons that are played on some of the metro trains, and they show them going up and down the escalators. And it says, "Don't be aloof, be alert." And it shows the aloof character sort of falling down the escalator, and the alert one is walking up nicely, and that's their names, Aloof and Alert. And so it's just like this silly little cartoon, but I have never forgotten it ever since I saw it, because it made me laugh and it was silly. And sometimes making a potential risk humorous in a message, depending on the gravity of the situation and everything, can really help people to remember and jog their memory to think about those things. Obviously, creating a little bit of humor of just about paying attention when you're on the escalator or when you're on the stairs. That's something that can help people think about that. Don't be aloof, be alert. So having those little things can potentially make your message stick a little bit more. And then again, we're going back to this know your audience piece, and that comes up a lot because it's so integral to having an effective communication. Tailor your communication to your audience, really know who your audience is. Communications that are developed for everyone and to no one in particular don't tend to be super effective. So really understanding who you're talking to and what's important for them to know can help your message be received. So here I wanted to provide some examples, because at this point in the presentation and the training, you're kind of wondering probably, okay, so what does this actually look like in practice? What is it for something to be a simple and clear message? What is a communication about risk look like? So these examples here were pulled from examples provided by the de Beaumont Foundation, and I've provided a link here, and I encourage you to go to this link and explore more. What they did is they did a lot of polling and focus group type research to understand how people thought about COVID-19 related risks, and then used that information that they learned from talking to people and polling people to develop messages. So really implementing this, understanding your audience to create messages that will hopefully be simple, clear, and effective. So a couple of examples here. Getting vaccinated will help keep you, your family, and your community healthy and safe. A pretty simple message about what vaccinating will accomplish for someone. Vaccines will help bring this pandemic to an end. So again, here we're seeing a focus of the positivity of what the vaccines will bring us. And a lot of people want this pandemic to end. And so knowing that there is something out there that can help with this, and this is a very simple message, this is something that you can use to talk about vaccines. And here's one that really sort of embodies this empathy that we were talking about earlier, and acknowledging what we don't know and what we do know, and the concerns that people have. If you're skeptical or concerned about side effects, we hear you. The likelihood of a severe side effect is less than 0.5%. When mild side effects occur, they are a normal sign your body is building protection to the virus, and most go away in a few days. So what this tells people is that it's not very likely, there's a very small chance that any severe side effect would happen. And that actually, if you feel a little bit of something happening, if you have some side effects, that's not a bad sign. That's actually a sign that the vaccine is working. So this is important information to address concerns that people have about the safety of the vaccine and also what they'll experience. Another reason why this is important is if people are expecting to go in and get the vaccine and not have any side effects, and then they do have a fever or body aches, or some swollen lymph nodes or a headache, and they weren't expecting that, they could get really scared that something bad is happening to them, when in reality, that just means the vaccine is doing its job. So these communications that attune to people's concerns are really important.
So in taking the examples that we were looking at on the previous slide, we're going to now like think more about strategic ways to, draw on health communication risk related to the vaccine as an example. Thinking about those tips before, like being memorable, tailored, specific, strategic. I want to also just sort of point out some things that have come up anecdotally from people in the community, people who are doing studies to gather information from community members about COVID and the vaccine, and to share some things to think about in this context. I mentioned previously when we were talking about the stages of change model that there are some people who are in the contemplation stage or preparation stage where maybe they haven't gotten the vaccine yet, but we make an assumption that they're not going to get it. When you're developing messages, don't assume vaccine hesitancy is the issue. There are a number of people who are in the wait and learn group where they're wanting to get more information or see how things are going with the vaccine for different people in their communities and networks. But also, when the vaccine was first rolled out, like earlier this year, there was an assumption that more people were vaccine hesitancy oriented than they actually were. When the vaccine became available, in particular, for example, communities of color, there are a number of communities of color where lots of people are interested in getting the vaccine and showing up to various outlets to get it, right? So don't make the assumption that people are hesitant. It may be a matter of just needing more information. I mentioned this before, be honest about what we don't know, be honest about the side effects, but also encourage people who have been vaccinated to share their experiences. I'll use myself as an example. In January, I was in that wait and learn group. I'm like, I understand the vaccine. I'm interested in it, but I don't know enough. And so people in my family, were some of the first to get vaccinated. And I was able to couple that, with the research that I did, ask them questions. What is it like? What were your side effects? How are you feeling? Did my own research. And so having people share with me their experiences made a world of difference. And so I personally have been passing it forward and sharing people about my own personal experiences. Think about the gains from getting vaccinated, and reminding people why we get vaccinated. There's a lot of concern about the vaccine having been created too fast or, how effective is it? But rather than focusing on the negative, acknowledge it, not saying to ignore it or blow it off, but remind people that there are benefits to herd immunity. If we all get vaccinated, it does reduce our chances of getting sick or having severe experiences if we are exposed to the vaccine, to the virus. Remind people of why we get the flu vaccine, if that helps to contextualize and make it more relatable to them, right? People, for example, have started having concerns about the vaccine more than once. I've gotten 2 doses. I'm hearing there's a 3rd dose, right? Help people understand that as science advances, if it comes to that, this is not new to us. The flu vaccine we get on an annual basis. Some populations get a pneumonia vaccine. So just remind them of the benefits of getting vaccinated or following the guidelines. And then reinforce social norms and sort of reiterate the positive aspect, reinforce positive social norms, get vaccinated, sure, but also wear your mask and continue to, social distance. And the reason is because a person who gets vaccinated can still pass on the vaccine if they're asymptomatic. Remember, the vaccine is not a cure, but it's to reduce the severity of the side effects of getting sick or reduce the severity of your illness, right? So just continue to reinforce that. And don't don't expect to know everything. You don't have to be an expert. You know, whatever you don't know, be transparent in that. But do take time to look up certain terms and definitions and practice pronouncing certain words, so that when you are have an opportunity to share with people, you can present the information clearly. That does enhance your credibility, that you know what you're talking about. But, you know, if at all, don't be reluctant to point people in the right direction to go get more information if you're unsure. There are a few more examples that we've sort of hit on already. Connecting with people's values, you know, that's in line with meeting people where they are. When you communicate with people, don't be surprised if people tend to favor information that confirms their own beliefs. You know, there will be people who don't believe that the pandemic is real, or they don't believe the vaccine is safe, right? And so people will, you know, they will lean toward their beliefs and values, and that's okay, as long as you're presenting factual information. Prepare for discomfort, you know, or distrust. You know, there are a lot of people who don't trust science, and for good reason. The next bullet kind of speaks to that. There's been a lot of historical trauma that's happened over the decades, particularly around communities of color. And so acknowledge it, name it. I think that's also a way to establish trust and connect with different groups by acknowledging what has happened in the past. And avoid shaming people. Anecdotally, you hear people say, you know, you shouldn't get that. That's foolish. You don't know what's going to happen to you. And let people be themselves and make their own choices. And don't shame people. And then another thing I think related to like being memorable is tell stories. You know, when I've spoken with people about these topics, I've shared my own examples, you know, and my own experiences with them, and experiences of my family members. And that is kind of helpful to contextualize that this is, you know, how this has impacted me as a person. And so for what that's worth. So these are just a few strategies to think about in the context of, you know, communicating around the vaccine. So we're going to shift and have you all participate in a couple of knowledge check exercises to get you thinking more critically about the process of risk communication.